Measurement of blood pressure in positions other than sitting may be necessary during the course of patient examination or intervention, including when screening for orthostatic hypotension or to measure blood pressure during standing exercise. When performing a standing blood pressure, patient safety should be the first consideration. For example, when a balance impairment is identified, using a gait belt or second person should be considered. Additionally, the measurement site, most commonly the upper arm, should be placed at a level of the right atrium, which can be externally located at the midpoint of the sternum or the fourth intercostal space. This may require the use of an elevated bedside table or placement of the arm on the evaluator's shoulder to accommodate the varying positions. When moving from the more dependent position of supine to a sitting and then to a standing posture, some elevation in blood pressure is expected. For example, it is widely accepted the diastolic pressure measured while sitting can be up to 5 millimeters of mercury higher than when measured in supine. However, there is less agreement about the range of systolic blood pressure variations. An orthostatic response to position change is considered abnormal if the systolic pressure drops greater than or equal to 20 millimeters of mercury, or the diastolic pressure drops greater than or equal to 10 millimeters of mercury at a 1 minute and/or a 3-minute interval after the individual has transitioned to a more independent position. Additionally, a condition known as initial orthostatic hypotension is defined as a decrease in systolic blood pressure of greater than or equal to 40 millimeters of mercury and/or a decrease in diastolic blood pressure of greater than or equal to 20 millimeters of mercury. This finding would present within the first 15 seconds of standing and corrects within 30 to 60 seconds of standing. However, in most clinical settings, the equipment functionality limits the therapist's ability to capture these fast adaptations within the vascular system. Therefore, these measures are usually performed within a laboratory setting. Should a physical therapist identify an abnormal response to position change, responsive action and intervention include notifying the physician, especially if a new finding, educating the individual on fall prevention and counter pressure maneuvers, and possibly referring to a medication management team or pharmacist if that is available in your practice setting.